Welcome to the CCRN Mastery, the ultimate study guide for adult critical care nurses. Whether you're striving to elevate your nursing expertise, expand your career opportunities, or achieve your CCRN certification, you've come to the right place. This video is designed to guide you through the core concepts of critical care nursing, offering real-world scenarios, practical strategies, and key insights to help you excel. After each chapter, you'll find a dedicated Q&A session to reinforce your learning. For comprehensive preparation, check the description for access to the Audible version, the free Ultimate Exam Prep Guide, or the Amazon link for the book. Don't forget to like and subscribe for more updates and practice content. Now, let's begin this journey towards CCRN success with your instructor.
Number 1. What is the initial management step for a patient experiencing a ventricular fibrillation cardiac arrest? A. Immediate defibrillation. B. Administration of epinephrine. C. Initiation of CPR. Or D. Insertion of an IV line. The answer is A. Immediate defibrillation. Number 2. In the context of ARDS, acute respiratory distress syndrome, which ventilator setting is most crucial to prevent further lung injury? A. High PEEP, positive end expiry pressure. B. Low tidal volume. C. High respiratory rate. Or D. Increased FiO2, fraction of inspired oxygen. The answer is B. Low tidal volume. Number 3. Which of the following is a common complication associated with the insertion of a central venous catheter? A. Pneumothorax. B. Pulmonary embolism. C. Ventricular arrhythmias. Or D. Hemorrhagic stroke. The answer is A. Pneumothorax. 4. When managing a patient with septic shock, which initial fluid therapy is recommended? A. 5% dextrose in water. B. 0.9% saline. C. Albumin solution. Or D. Hetastarch. The answer is B. 0.9% saline. Number 5. In the treatment of acute coronary syndrome, ACS, which medication is primarily used to reduce myocardial oxygen demand? A. Aspirin. B. Nitroglycerin. C. Beta blockers. D. ACE inhibitors. The answer is C. Beta blockers. Number 6. What is the primary goal of therapeutic hypothermia in post-cardiac arrest? A. To reduce fever. B. To slow metabolic rate. C. To prevent infection. Or D. To increase blood pressure. The answer is B. To slow metabolic rate. Number 7. For a patient with intracranial hypertension, which nursing intervention is most appropriate? A. Elevating the head of the bed to 30 degrees. B. Maintaining neck flexion. C. Frequent repositioning of the patient. D. Administration of hypertonic saline. The answer is A. Elevating the head of the bed to 30 degrees. Number 8. Which electrolyte imbalance is most commonly associated with torsade de pointes? A. Hyperkalemia. B. Hypokalemia. C. Hypermagnesemia. Or D. Hypocalcemia. The answer is B. Hypokalemia. Number 9. In the management of acute pancreatitis, what is the initial nutritional strategy? A. High-fat diet. B. Enteral nutrition. C. Parenteral nutrition. Or D. NPO, nil per os. The answer is D. NPO, nil per os. Number 10. Which hemodynamic parameter is the best indicator of left ventricular preload? A. Central venous pressure, CVP. B. Pulmonary artery occlusion pressure, PAOP. C. Cardiac output. Or D. Systemic vascular resistance, SVR. The answer is B. pulmonary artery occlusion pressure, PAOP. Number 11. What is the first-line treatment for a patient diagnosed with acute ischemic stroke? A. Intravenous thrombolytics. B. Antiplatelet therapy. C. Anticoagulation. Or D. Surgical intervention. The answer is A. Intravenous thrombolytics. Number 12. In a patient with diabetic ketoacidosis, DKA, which laboratory value should be monitored closely? A. Serum potassium. B. Serum sodium. C. Complete blood count. Or D. Liver enzymes. The answer is A. Serum potassium. Number 13. What is the primary concern in the first 24 hours following a major burn injury? A. Infection. B. Hypothermia. C. Fluid loss and hypovolemia. Or D. Pain management. The answer is C. Fluid loss and hypovolemia. 14. In the care of a patient with an acute kidney injury, AKI, which parameter is most important to monitor? A. Urine output. B. Blood glucose levels. C. White blood cell count. Or D. Platelet count. The answer is A. Urine output. Number 15. What is the most common cause of acute liver failure in the United States? A. Hepatitis B. B. Alcohol abuse. C. Drug-induced hepatotoxicity. Or D. Autoimmune hepatitis. The answer is C. Drug-induced hepatotoxicity. Number 16. For a patient in status epilepticus, which medication is first-line treatment? A. Phenytoin. B. Lorazepam. C. Levetiracetam. Or D. Carbamazepine. The answer is B. Lorazepam. Number 17. Which assessment finding is most indicative of early sepsis? A. Bradycardia. B. Hypertension. C. Tachypnea. Or D. Decreased urine output. The answer is C. Tachypnea. Number 18. In treating a patient with acute pulmonary edema, which medication provides rapid symptomatic relief? A. Furosemide. B. Digoxin. C. Dobutamine. Or D. Amiodarone. The answer is A. Furosemide. Number 19. What is the primary goal in the management of a patient with ARDS, acute respiratory distress syndrome? A. To normalize arterial oxygen levels. B. To maintain adequate ventilation and oxygenation. C. To reduce airway resistance. Or D. To increase lung compliance. The answer is B. To maintain adequate ventilation and oxygenation. Number 20. In a patient with a traumatic brain injury, what is the most important factor to control to prevent secondary brain injury? A. Blood glucose levels. B. Blood pressure. C. Intracranial pressure. Or D. Body temperature. The answer is C. Intracranial pressure. Number 21. Which intervention is most effective in preventing ventilator-associated pneumonia in critically ill patients? A. Routine antibiotic prophylaxis. B. Daily sedation vacations. C. Elevating the head of the bed. Or D. Frequent oral care with chlorhexidine. The answer is C. Elevating the head of the bed. 22. What is the primary indicator for the initiation of renal replacement therapy in a patient with acute kidney injury? A. Hypertension. B. Oliguria. C. Hyperkalemia. Or D. Anemia. The answer is C. Hyperkalemia. Number 23. In the management of a patient with an upper GI bleed, what is the initial step? A. Endoscopy. B. Administration of proton pump inhibitors. C. Blood transfusion. Or D. Gastric lavage. The answer is B. administration of proton pump inhibitors. Number 24. For a patient with a suspected myocardial infarction, which diagnostic test provides the most definitive information? A. EKG, B. Troponin levels, C. Chest X-ray, or D. Echocardiogram. The answer is B. Troponin levels. Number 25. Which statement is true regarding the management of a patient with a pulmonary embolism? A. Immediate administration of a thrombolytic is always indicated. B. Anticoagulation is the mainstay of treatment. C. Bed rest is recommended until symptoms resolve. Or D. Oxygen therapy is contraindicated. The answer is B. Anticoagulation is the mainstay of treatment. Number 26. In the care of a patient with a subarachnoid hemorrhage, which complication is most crucial to monitor for? A. Seizure, B. Vasospasm, C. Hydrocephalus, or D. Hypotension. The answer is B. Vasospasm. Number 27. What is the most effective strategy for the prevention of catheter-associated urinary tract infections in hospitalized patients? A. Daily antibiotic prophylaxis, B. Frequent catheter replacement, C. Using sterile techniques during catheter insertion, or D. Early removal of the catheter. The answer is D. Early removal of the catheter. Number 28. What is the first-line pharmacological treatment for symptomatic bradycardia? A. Atropine, B. Dopamine, C. Epinephrine, or D. Amiodarone. The answer is A. Atropine. Number 29. In a patient with acute respiratory failure, which blood gas finding indicates respiratory acidosis? A. Low pH and high PaCO2, B. High pH and low PaCO2, C. Low pH and low PaCO2, or D. High pH and high PaCO2. The answer is A. Low pH and high PaCO2. Number 30. What is the primary goal in the management of a patient with cardiogenic shock? A. Increasing heart rate, B. Decreasing myocardial oxygen demand, C. Reducing preload, or D. Increasing afterload. The answer is B. Decreasing myocardial oxygen demand. Number 31. Which assessment is most crucial for a patient with a suspected spinal cord injury? A. Motor and sensory function, B. Bowel and bladder control, C. Skin integrity, or D. Cranial nerve function. The answer is A. Motor and sensory function. Number 32. In the treatment of severe sepsis, which medication is commonly used to maintain adequate blood pressure? A. Dopamine, B. Norepinephrine, C. Dobutamine, or D. Epinephrine. The answer is B. Norepinephrine. Number 33. What is the most common complication following a myocardial infarction? A. Arrhythmia, B. Heart failure, C. Stroke, or D. Pericarditis. The answer is A. Arrhythmia. Number 34. For a patient with a Glasgow Coma Scale, GCS, score of 8 or less, what is the recommended intervention? A. Routine neurological assessments, B. Immediate intubation, C. Administration of mannitol, or D. Placement in the Trendelenburg position. The answer is B. Immediate intubation. Number 35. Which laboratory parameter is most indicative of acute liver failure? A. Elevated liver enzymes, B. Low albumin levels, C. Prolonged prothrombin time, or D. Elevated bilirubin levels. The answer is C. Prolonged prothrombin time. Number 36. In managing a patient with a massive transfusion, what is the primary concern? A. Hypothermia, B. Hypertension, C. Coagulopathy, or D. Hyperkalemia? The answer is C. Coagulopathy. Number 37. What is the most effective intervention for preventing deep vein thrombosis, DVT, in critically ill patients? A. Early mobilization, B. High-dose anticoagulation, C. Compression stockings, or D. Sequential compression devices? The answer is A. Early mobilization. Number 38. In the management of a patient with diabetic ketoacidosis, what is the primary reason for administering insulin? A. To correct hyperglycemia, B. To suppress ketone production, C. To increase urine output, or D. To correct electrolyte imbalances? The answer is B. To suppress ketone production. 39. For a patient with a suspected tension pneumothorax, what is the immediate intervention? A. Chest X-ray, B. Administration of oxygen, C. Needle decompression, or D. Thoracotomy? The answer is C. Needle decompression. Number 40. In a patient with a suspected pulmonary embolism, what is the preferred diagnostic test? A. Chest X-ray, B. CT pulmonary angiography, C. Ventilation perfusion scan, or D. Echocardiogram? The answer is B. CT pulmonary angiography. Number 41. What is the mainstay of treatment for a patient with acute asthma exacerbation? A. Corticosteroids, B. Anticholinergics, C. Beta agonists, or D. Oxygen therapy? The answer is C. Beta agonists. Number 42. Which factor is most strongly associated with the development of acute kidney injury in critically ill patients? A. Hypertension, B. Diabetes mellitus, C. Hypovolemia, or D. Age? The answer is C. Hypovolemia. Number 43. What is the primary treatment for a patient with symptomatic hypoglycemia? A. Oral carbohydrates, B. Intravenous glucose, C. Subcutaneous insulin, or D. Intramuscular glucagon? The answer is B. Intravenous glucose. In a patient with septic shock, what is the target mean arterial pressure, MAP, for fluid resuscitation? A. Greater than or equal to 65 millimeters of mercury, B. Greater than or equal to 75 millimeters mercury, C. Greater than or equal to 85 millimeters of mercury, or D. Greater than or equal to 95 millimeters of mercury? The answer is A. Greater than or equal to 65 millimeters mercury. Number 45. What is the primary reason for using hypothermia in a post-cardiac arrest patient? A. To reduce fever, B. To decrease brain metabolism, C. To prevent infection, or D. To reduce blood pressure? The answer is B. To decrease brain metabolism. Number 46. Which symptom is most indicative of left-sided heart failure? A. Peripheral edema, B. Ascites, C. Pulmonary congestion, or D. Jugular vein distension? The answer is C. Pulmonary congestion. Number 47. What is the most appropriate first step in managing a patient with suspected bacterial meningitis? A. Initiate antibiotic therapy, B. Perform a lumbar puncture, C. Administer antipyretics, or D. Obtain a CT scan of the head? The answer is A. Initiate antibiotic therapy. 48. What is the most common early sign of a transfusion reaction? A. Hypertension, B. Fevers and chills, C. Urticaria, or D. Tachycardia? The answer is B. Fevers and chills. Number 49. In a patient with acute respiratory distress syndrome, ARDS, what is the recommended strategy for mechanical ventilation? A. High tidal volumes. B. Low tidal volumes. C. High positive end expiratory pressure, PEEP. Or D. Low respiratory rate. The answer is B. Low tidal volumes. Number 50. For a patient experiencing an anaphylactic reaction, what is the first-line medication? A. Corticosteroids. B. Antihistamines. C. Epinephrine. Or D. Beta agonists. The answer is C. Epinephrine. Number 51. Which assessment finding is crucial in diagnosing a patient with neurogenic shock? A. Tachycardia. B. Hypotension. C. Hyperthermia. Or D. Bradycardia. The answer is B. Hypotension. Number 52. What is the priority nursing intervention for a patient with a flail chest? A. Pain management. B. Mechanical ventilation. C. Fluid resuscitation. Or D. Chest physiotherapy. The answer is A. Pain management. Number 53. In a patient with a suspected carbon monoxide poisoning, what is the most effective treatment? A. High-flow oxygen. B. Hyperbaric oxygen therapy. C. Mechanical ventilation. Or D. Intravenous fluids. The answer is B. Hyperbaric oxygen therapy. Number 54. What is the most significant risk factor for developing a hospital-acquired pressure ulcer? A. Age. B. Malnutrition. C. Immobility. Or D. Incontinence. The answer is C. Immobility. Number 55. In the management of a patient with status asthmaticus, what is the primary goal of treatment? A. To reduce airway inflammation. B. To correct hypoxemia. C. To reverse airway obstruction. Or D. To prevent respiratory arrest. The answer is C. To reverse airway obstruction. Number 56. What is the first-line treatment for a patient with acute variceal bleeding? A. Endoscopic therapy. B. Vasopressor therapy. C. Blood transfusion. Or D. Beta blocker therapy. The answer is A. Endoscopic therapy. 57. In a patient with traumatic brain injury, which factor is most predicative of poor outcome? A. Age of the patient. B. Initial Glasgow Coma Scale score. C. Presence of hypotension. D. Duration of loss of consciousness. The answer is B. Initial Glasgow Coma Scale score. Number 58. What is the most effective strategy for preventing central line-associated bloodstream infections? A. Antibiotic lock therapy. B. Daily chlorhexidine bathing. C. Using ultrasound guidance for insertion. Or D. Strict adherence to aseptic technique. The answer is D. Strict adherence to aseptic technique. Number 59. Which medication is most effective for treating acute decompensated heart failure with pulmonary edema? A. ACE inhibitors. B. Diuretics. C. Beta blockers. Or D. Calcium channel blockers. The answer is B. Diuretics. Number 60. In a patient with acute liver failure, which finding is indicative of hepatic encephalopathy? A. Jaundice. B. Ascites. C. Asterixis. Or D. Spider angiomas. The answer is C. Asterixis. Number 61. What is the primary goal in the treatment of a patient with disseminated intravascular coagulation, DIC? A. Replacing coagulation factors. B. Administering anticoagulants, C. Treating the underlying cause, or D. Platelet transfusion? The answer is C. Treating the underlying cause. Number 62. For a patient with acute renal failure, what is the most reliable indicator of fluid status? A. Urine output, B. Blood urea nitrogen, BUN, C. Serum creatinine, or D. Central venous pressure? The answer is D. Central venous pressure. Number 63. What is the first-line treatment for a patient with hypertensive emergency? A. Oral antihypertensives, B. Intravenous beta blockers, C. Intravenous vasodilators, or D. Diuretics? The answer is C. Intravenous vasodilators. Number 64. In the management of a patient with acute stroke, what is the time window for administering intravenous thrombolytics? A. Within 3 hours of symptom onset. B. Within 4.5 hours of symptom onset. C. Within 6 hours of symptom onset. Or D. Within 12 hours of symptom onset? The answer is B. Within 4.5 hours of symptom onset. Number 65. What is the primary intervention for a patient with suspected tension pneumothorax? A. Oxygen administration, B. Chest tube insertion, C. Needle decompression, or D. Positive pressure ventilation? The answer is C. Needle decompression. Number 66. In the treatment of septic shock, what is the role of corticosteroids? A. First-line therapy, B. Used in refractory shock, C. Preventative treatment, or D. Used in all septic patients? The answer is B. Used in refractory shock. Number 67. What is the most common cause of hypoxia in critically ill patients? A. Hypoventilation, B. Pulmonary embolism, C. Atelectasis, or D. Ventilation perfusion mismatch? The answer is D. Ventilation perfusion mismatch. 68. For a patient with an upper gastrointestinal bleed, what is the initial nursing intervention? A. Administration of a proton pump inhibitor, B. Insertion of a nasogastric tube, C. Endoscopy, or D. Fluid resuscitation? The answer is D. Fluid resuscitation. 69. What is the most effective method for preventing the spread of multi-drug resistant organisms in a hospital setting? A. Hand hygiene, B. Routine use of antibiotics, C. Isolation of infected patients, or D. Regular disinfection of patient areas? The answer is A. Hand hygiene. Number 70. In a patient with acute myocardial infarction, what is the significance of ST segment elevation? A. Indicates a non-transmural infarction, B. Is a benign finding, C. Indicates an area of ischemia, or D. Suggests a transmural infarction? The answer is D. Suggests a transmural infarction. Number 71. What is the most appropriate initial management for a patient with acute upper gastrointestinal bleeding? A. Nasogastric lavage, B. Intravenous proton pump inhibitors, C. Endoscopic evaluation, or D. Blood transfusion? The answer is B. Intravenous proton pump inhibitors. Number 72. In the management of acute renal failure, what is the primary goal of fluid administration? A. To increase urine output, B. To correct electrolyte imbalances, C. To maintain adequate renal perfusion, or D. To reduce serum creatinine levels? The answer is C. To maintain adequate renal perfusion. 73. Which ventilator mode is most commonly used for patients with acute respiratory failure who can initiate breaths? A. Volume control ventilation. B. Pressure control ventilation. C. Synchronized intermittent mandatory ventilation, SIMV. Or D. Continuous positive airway pressure, CPAP. The answer is C. Synchronized intermittent mandatory ventilation, SIMV. Number 74. What is the first-line treatment for symptomatic bradycardia in a hemodynamically unstable patient? A. Atropine. B. Pacemaker. C. Epinephrine. Or D. Dopamine. The answer is A. Atropine. 75. In the management of a patient with diabetic ketoacidosis, what is the importance of potassium replacement? A. To prevent arrhythmias. B. To correct acidosis. C. To enhance insulin effectiveness. Or D. To increase urine output. The answer is A. To prevent arrhythmias. Number 76. Which sign or symptom is most indicative of left side heart failure? A. Peripheral edema. B. Jugular venous distension. C. Orthopnea. Or D. Hepatomegaly. The answer is C. Orthopnea. Number 77. What is the primary goal in the management of a patient with septic shock? A. To reduce fever. B. To maintain adequate tissue perfusion. C. To normalize white blood cell count. Or D. To eradicate the infection. The answer is B. To maintain adequate tissue perfusion. Number 78. In a patient with suspected acute coronary syndrome, what is the significance of elevated troponin levels? A. Indicates stable angina. B. Is a normal finding. C. Suggests myocardial injury. Or D. Indicates pericarditis. The answer is C. Suggests myocardial injury. 79. What is the most effective strategy for preventing ventilator-associated lung injury in ARDS? A. High tidal volume ventilation. B. Low tidal volume ventilation. C. High-frequency oscillatory ventilation. Or D. Prone positioning. The answer is B. Low tidal volume ventilation. Number 80. For a patient with acute pulmonary embolism, what is the primary treatment? A. Thrombolytic therapy. B. Anticoagulation. C. Surgical embolectomy. Or D. Oxygen therapy. The answer is B. Anticoagulation. Number 81. What is the first-line medication for acute rate control in atrial fibrillation? A. Amiodarone. B. Digoxin. C. Diltiazem. Or D. Metoprolol. The answer is C. Diltiazem. Number 82. In a patient with a traumatic brain injury, what is the most important factor to monitor to prevent secondary injury? A. Serum glucose levels. B. Intracranial pressure. C. Oxygen saturation. Or D. Blood pressure. The answer is B. Intracranial pressure. Number 83. What is the primary indication for initiating renal replacement therapy in a patient with acute kidney injury? A. Hypertension. B. Oliguria. C. Hyperkalemia. Or D. Elevated BUN. The answer is C. Hyperkalemia. Number 84. In the treatment of a patient with severe sepsis, what is the role of activated protein C? A. To reduce inflammation. B. To improve microcirculation. C. To decrease coagulation. Or D. To enhance antibiotic effectiveness. The answer is C. To decrease coagulation. Number 85. What is the most appropriate initial step in managing a patient with a suspected spinal cord injury? A. Administration of corticosteroids. B. Immediate surgery. C. Spinal immobilization. Or D. High-dose diuretics. The answer is C. Spinal immobilization. Number 86. For a patient with a suspected tension pneumothorax, what is the immediate intervention? A. Chest X-ray. B. Oxygen administration. C. Needle decompression. Or D. Positive pressure ventilation. The answer is C. Needle decompression. Number 87. What is the primary treatment for a patient with an acute exacerbation of chronic obstructive pulmonary disease, COPD? A. Antibiotics. B. Corticosteroids. C. Oxygen therapy. Or B. Beta agonists. The answer is B. Corticosteroids. Number 88. In a patient with acute liver failure, what is the primary concern regarding brain function? A. Cerebral edema. B. Seizures. C. Stroke. D. Encephalopathy. The answer is A. Cerebral edema. Number 89. What is the first-line treatment for a patient with symptomatic hypoglycemia? A. Oral glucose. B. Intravenous dextrose. C. Glucagon injection. Or D. Complex carbohydrates. The answer is B. Intravenous dextrose. 90. In the management of a patient with a massive pulmonary embolism, what is the primary intervention? A. Anticoagulant therapy. B. Thrombolytic therapy. C. Surgical embolectomy. Or D. Oxygen supplementation. The answer is B. Thrombolytic therapy. 91. What is the recommended treatment for a patient with a burn injury and inhalation trauma? A. High-flow oxygen. B. Corticosteroids. C. Escherectomy. Or D. Mechanical ventilation with PEEP. The answer is D. Mechanical ventilation with PEEP. 92. In a patient with acute decompensated heart failure, what is the primary reason for administering diuretics? A. To decrease blood pressure. B. To improve renal function. C. To reduce pulmonary congestion. Or D. To correct electrolyte imbalances. The answer is C. To reduce pulmonary congestion. 93. For a patient with suspected meningitis, what is the most important diagnostic test? A. Blood cultures. B. CT scan of the head. C. Lumbar puncture. Or D. EEG. The answer is C. Lumbar puncture. 94. What is the primary goal of using vasopressors in the treatment of shock? A. To increase cardiac output. B. To reduce heart rate. C. To improve tissue perfusion. Or D. To decrease preload. The answer is C. To improve tissue perfusion. 95. In a patient with acute pancreatitis, what is the best indicator of disease severity? A. Serum amylase levels. B. Serum lipase levels. C. Ranson's criteria. Or D. Abdominal ultrasound findings. The answer is C. Ranson's criteria. 96. What is the most common cause of acute kidney injury in hospitalized patients? A. Nephrotoxic medications. B. Glomerulonephritis. C. Urinary tract obstruction. Or D. Prerenal azotemia. The answer is D. Prerenal azotemia. 97. What is the initial management for a patient with acute ischemic stroke and elevated blood pressure? A. Immediate antihypertensive therapy. B. Thrombolytic therapy. C. delayed blood pressure management, or D, intravenous fluids? The answer is A, immediate antihypertensive therapy. 98. In the care of a patient with ARDS, what is the rationale for using prone positioning? A, to reduce the work of breathing. B, to improve ventilation perfusion matching. C, to prevent ventilator-associated pneumonia. D, to increase lung compliance. The answer is B, to improve ventilation perfusion matching. Number 99. What is the primary concern in the first hour of treating a patient with septic shock? A, antibiotic administration. B, fluid resuscitation. C, blood culture collection. Or D, vasopressor initiation. The answer is B, fluid resuscitation. 100. In a patient with diabetic ketoacidosis, what is the primary goal of fluid therapy? A, to correct electrolyte imbalances. B, to improve renal function. C, to restore intravascular volume. Or D, to reduce blood glucose levels. The answer is C, to restore intravascular volume. Number 101. What is the most appropriate treatment for a patient with a tension pneumothorax? A, oxygen therapy. B, needle decompression. C, chest tube insertion. Or D, positive pressure ventilation. The answer is B, needle decompression. 102. For a patient with acute myocardial infarction, why is early reperfusion therapy important? A, to prevent heart failure. B, to reduce the size of the infarct. C, to lower blood pressure. D, to control arrhythmias. The answer is B, to reduce the size of the infarct. 103. In a patient with acute liver failure, what is the most important factor in preventing further liver damage? A, nutritional support. B, avoidance of hepatotoxic drugs. C, blood transfusions. Or D, liver transplantation. The answer is B, avoidance of hepatotoxic drugs. 104. What is the primary goal in managing a patient with hypovolemic shock? A, vasopressor administration. B, rapid fluid resuscitation. C, hemostasis. Or D, oxygen supplementation. The answer is B, rapid fluid resuscitation. 105. In a patient with a subarachnoid hemorrhage, what is the primary concern during the acute phase? A, seizures. B, rebleeding. C, vasospasm. Or D, hydrocephalus. The answer is B, rebleeding. 106. What is the most effective strategy for reducing the risk of catheter-related bloodstream infections? A, routine replacement of central venous catheters. B, use of antibiotic-impregnated catheters. C, strict aseptic technique during insertion and care. And D, frequent dressing changes. The answer is C, strict aseptic technique during insertion and care. 107. In the management of a patient with anaphylaxis, what is the role of corticosteroids? A, first-line treatment. B, used to prevent late-phase reactions. C, used as a substitute for epinephrine. D, used to treat hypotension. The answer is B, used to prevent late-phase reactions. 108. For a patient with a massive hemoptysis, what is the initial management? A, bronchoscopy. B, mechanical ventilation. C, lateral decubitus positioning. Or D, intravenous antibiotics. The answer is C, lateral decubitus positioning. 109. What is the primary goal of sedation in mechanically ventilated patients? A. To prevent ventilator-associated lung injury. B. To ensure patient ventilator synchrony. C. To reduce anxiety and discomfort. D. To facilitate weaning from mechanical ventilation. The answer is B. To ensure patient ventilator synchrony. 110. In a patient with acute respiratory failure, what is the indication for non-invasive ventilation? A. To treat hypercapnic respiratory failure. B. As a first-line treatment for ARDS. C. To manage hypoxemic respiratory failure. Or D. To avoid intubation in patients with DNR orders. The answer is A. To treat hypercapnic respiratory failure. 111. What is the primary nursing intervention for a patient experiencing acute chest pain suspected to be myocardial infarction? A. Administration of aspirin. B. Immediate angioplasty. C. High-flow oxygen therapy. Or D. Intravenous nitroglycerin. The answer is A. Administration of aspirin. 112. In a patient with severe sepsis, what is the significance of lactate levels in guiding resuscitation efforts? A. High levels indicate effective resuscitation. B. They are unrelated to sepsis severity. C. High levels indicate inadequate tissue perfusion. D. They determine the need for antibiotic therapy. The answer is C. High levels indicate inadequate tissue perfusion. 113. What is the most appropriate intervention for a patient with a suspected opioid overdose? A. Gastric lavage. B. Administration of naloxone. C. High-dose oxygen. D. Fluid resuscitation. The answer is B. Administration of naloxone. 114. In a patient with a suspected acute aortic dissection, what is the first-line imaging study? A. Chest X-ray. B. Transthoracic echocardiogram. C. CT scan with contrast. D. MRI of the chest. The answer is C. CT scan with contrast. 115. What is the primary goal in the management of a patient with a massive hemoptysis? A. To control bleeding. B. To maintain airway patency. C. To prevent infection. D. To administer antibiotics. The answer is B. To maintain airway patency. 116. For a patient with acute renal failure and hyperkalemia, what is the most immediate treatment? A. Hemodialysis. Calcium gluconate administration. C. Sodium bicarbonate infusion. Or D. Insulin and glucose administration. The answer is B. Calcium gluconate administration. 117. In a patient with acute respiratory distress syndrome, ARDS, what is the rationale for using low tidal volume ventilation strategy? A. To increase oxygenation. B. To reduce the risk of ventilator-induced lung injury. C. To decrease carbon dioxide levels. D. To increase lung compliance. The answer is B. To reduce the risk of ventilator-induced lung injury. 118. What is the first-line pharmacological treatment for a patient with acute mania? A. Antidepressants. B. Antipsychotics. C. Mood stabilizers. D. Benzodiazepines. The answer is C. Mood stabilizers. 119. In the management of a patient with a heat stroke, what is the most important initial intervention? A. Antipyretics administration. B. Rapid cooling. C. Intravenous fluid resuscitation. D. Electrolyte correction. The answer is B. Rapid cooling. 120. What is the primary indication for the use of inotropic agents in the treatment of heart failure? A. To reduce preload. B. To control heart rate. C. To improve cardiac contractility. D. To decrease afterload. The answer is C. To improve cardiac contractility. 121. In a patient with a suspected pulmonary embolism, what is the role of D-dimer testing? A. It is diagnostic for pulmonary embolism. B. It is used to assess the severity of embolism. C. It is used as a screening tool to rule out pulmonary embolism. D. It is used to monitor treatment response. The answer is C. It is used as a screening tool to rule out pulmonary embolism. 122. What is the most effective strategy for preventing hospital-acquired pneumonia in ventilated patients? A. Routine antibiotic prophylaxis. B. Sterile suctioning techniques. C. Semi-recumbent positioning. Or D. Daily oral care with chlorhexidine. The answer is D. Daily oral care with chlorhexidine. 123. In a patient with severe acute pancreatitis, what is the most common complication? A. Pancreatic pseudocyst. B. Hemorrhage. C. Infection. Or D. Diabetic ketoacidosis. The answer is C. Infection. 124. For a patient with a suspected stroke, what is the primary reason for a rapid assessment and treatment? A. To prevent secondary stroke. B. To improve the chances of recovery. C. To alleviate symptoms. Or D. To prevent long-term disability. The answer is B. To improve the chances of recovery. 125. What is the primary intervention for a patient with a suspected tension pneumothorax and hemodynamic instability? A. Chest X-ray. B. Immediate needle decompression. C. Oxygen administration. Or D. Fluid resuscitation. The answer is B. Immediate needle decompression. 126. In a patient with acute liver failure, what is the primary management strategy to prevent cerebral edema? A. High-dose corticosteroids. B. Hyperventilation. C. Mannitol administration. Or D. Restriction of fluid intake. The answer is C. Mannitol administration. 127. What is the most common early complication following a major surgical procedure? A. Infection. B. Thromboembolism. C. Acute renal failure. Or D. Atelectasis. The answer is D. Atelectasis. In a patient with a burn injury, what is the primary goal of fluid resuscitation in the first 24 hours? A. To maintain urine output. B. To prevent hypothermia. C. To stabilize hemodynamics. D. To correct electrolyte imbalances. The answer is C. To stabilize hemodynamics. 129. What is the primary indication for the use of continuous renal replacement therapy, CRRT, in critically ill patients? A. Severe hyperkalemia. B. Fluid overload unresponsive to diuretics. C. Acute glomerulonephritis. Or D. Chronic renal failure. The answer is B. Fluid overload unresponsive to diuretics. 130. In a patient with an acute ischemic stroke, what is the primary goal of early thrombolytic therapy? A. To prevent further clot formation. B. To reduce the risk of hemorrhagic transformation. C. To restore blood flow to the affected area of the brain. Or D. To lower blood pressure. The answer is C. To restore blood flow to the affected area of the brain. 131. In a patient with a severe head injury, What is the primary goal of managing intracranial pressure? A. To maintain a cerebral perfusion pressure above 60 millimeters mercury. B. To reduce cerebral blood flow. C. To ensure normal capnia. Or D. To prevent seizures. The answer is A. To maintain a cerebral perfusion pressure above 60 millimeters mercury. Number 32. What is the initial management for a patient with suspected toxic ingestion? A. Gastric lavage. B. Activated charcoal administration. C. Immediate intubation. Or D. Intravenous fluid restriction. The answer is B. Activated charcoal administration. 133. In a patient with acute respiratory failure, what is the primary indication for intubation and mechanical ventilation? A. Hypoxia that is unresponsive to supplemental oxygen. B. Respiratory rate above 30 breaths per minute. C. Presence of bilateral infiltrates on chest X-ray. D. Acidosis with a pH less than 7.25. The answer is A. Hypoxemia that is unresponsive to supplemental oxygen. Number 134. What is the most appropriate intervention for a patient with acute variceal hemorrhage? A. Endoscopic band ligation. B. Sclerotherapy. C. Systemic antibiotics. D. Vasopressor therapy. The answer is A. Endoscopic band ligation. 135. In the management of a patient with cardiogenic shock, what is the primary purpose of intra-aortic balloon pump IABP insertion? A. To reduce afterload. B. To increase preload. C. To improve coronary artery perfusion. D. To stabilize heart rhythm. The answer is A. To reduce afterload. 136. What is the primary indication for the administration of hypertonic saline in a patient with traumatic brain injury? A. To control seizures. B. To reduce intracranial pressure. C. To correct hyponatremia. Or D. To improve cerebral perfusion. The answer is B. To reduce intracranial pressure. 137. In a patient with acute pancreatitis, what is the most common cause of early mortality? A. Infection. B. Hemorrhage. C. Organ failure. D. Pseudocyst formation. The answer is C. Organ failure. 138. For a patient with a suspected myocardial infarction and contraindications to thrombolytics, what is the preferred treatment? A. Coronary artery bypass grafting. B. Percutaneous coronary intervention. C. High-dose statin therapy. D. Long-term anticoagulation. The answer is B. Percutaneous coronary intervention. 139. What is the primary treatment for a patient with an acute exacerbation of ulcerative colitis? A. Antibiotics. B. Surgical intervention. C. Corticosteroids. D. Probiotics. The answer is C. Corticosteroids. 140. In a patient with acute respiratory distress syndrome, ARDS, what is the significance of the PaO2/FiO2 ratio? A. It determines the need for mechanical ventilation. B. It is used to assess the severity of ARDS. C. It guides the choice of ventilator settings. D. It indicates the presence of a shunt. The answer is B. It is used to assess the severity of ARDS. 141. What is the primary goal in the management of a patient with neurogenic shock? A. To control pain. B. To maintain adequate blood pressure. C. To prevent deep vein thrombosis. Or D. To enhance neurological recovery. The answer is B. to maintain adequate blood pressure. 142. In a patient with acute liver failure, what is the most important factor in assessing prognosis? A. Serum bilirubin levels. B. Degree of encephalopathy. C. INR, International Normalization Ratio. Or D. Liver biopsy findings. The answer is C. INR, International Normalized Ratio. 143. For a patient with suspected bacterial meningitis, what is the importance of early antibiotic administration? A. It reduces the risk of complications. B. It decreases the duration of symptoms. C. It prevents the spread of infection to contacts. D. It reduces the risk of long-term neurological damage. The answer is A. It reduces the risk of complications. 144. What is the most effective strategy for preventing deep vein thrombosis in immobilized patients? A. Early mobilization. B. Sequential compression devices. C. Low molecular weight heparin. D. Warfarin therapy. The answer is C. Low molecular weight heparin. 145. In a patient with a severe asthma exacerbation, what is the primary goal of bronchodilator therapy? A. To reduce inflammation. B. To improve oxygenation. C. To relieve bronchospasm. D. To prevent respiratory failure. The answer is C. To relieve bronchospasm. 146. What is the primary consideration in the selection of a vasopressor agent for the treatment of septic shock? A. The patient's heart rate. B. The presence of arrhythmias. C. The patient's blood pressure. Or D. Underlying cause of sepsis. The answer is C. Patient's blood pressure. 147. In a patient with acute kidney injury, what is the significance of oliguria? A. It is a definitive sign of renal failure. B. It indicates pre-renal cause. C. It is an indication for immediate dialysis. D. It suggests a poor prognosis. The answer is B. It indicates a pre-renal cause. 148. What is the primary rationale for the use of sedation holidays in mechanically ventilated patients? A. To assess the patient's neurological status. B. To reduce the risk of ventilator-associated pneumonia. C. To facilitate weaning from the ventilator. D. To prevent drug dependence. The answer is A. To assess the patient's neurological status. 149. In the management of a patient with a pulmonary embolism, what is the role of echocardiography? A. To confirm the diagnosis. B. To assess the right ventricular function. C. To evaluate for deep vein thrombosis. D. To guide thrombolytic therapy. The answer is B. To assess the right ventricular function. 150. For a patient with acute hypoxemic respiratory failure, what is the primary indication for high-flow nasal cannula therapy? A. To deliver high concentrations of oxygen. B. To provide positive airway pressure. C. To reduce the work of breathing. D. To promote carbon dioxide elimination. The answer is A. To deliver high concentrations of oxygen.